Maintaining healthy bones begins with the knowledge and understanding of osteoporosis. Dr. Keith McCormick is the founder of Osteonaturals, and he is here to tell you more about how to improve both your skeletal and overall health. Dr. McCormick, osteoporosis, I have to be honest with you, I always thought that as long as I'm drinking my milk and eating my yogurt and getting my calcium, I'm going to have strong bones. Apparently that's not the case.
There's a lot more to it than that, Ashley. Osteoporosis is when it's a whole skeletal disease process. It's a systemic disease where the bone loses so much density, mineral density, and structural quality that deteriorates so much that a person's bones get really fragile, and they are very susceptible to fracturing their hip or their spine. And it's a very common disorder, actually. There's 10 million Americans have osteoporosis, and another 30 or 40 million have osteopenia. It's not quite as severe of bone loss as osteoporosis, but it still leaves them at greater risk for a fracture.
So it's more prevalent than we may realize. Now, you wrote a book about it. You've developed the supplements Osteonaturals. You're very passionate about it. Why are you so passionate about it?
Well, I'm a chiropractic physician. So I've always been really interested in bone, skeletal health and stuff, but it wasn't until about 15 years ago that I became really interested in the metabolic aspects of bone health. And the reason why is because I was diagnosed with osteoporosis, severe osteoporosis. And I went to several endocrinologists, 5 endocrinologists, and they all just wanted to give me bisphosphonates, medications to harden my skeleton. And there wasn't very much talk about diet, nutrition. And I didn't quite understand how just hardening up my skeleton would make me healthier, would make my bones healthier. So I totally immersed myself in the study of osteoporosis. I figured out how to improve my health, my bone health, and then I took it to my patients. I started helping my patients with bone health. I then wrote a book, as you said, The Whole Body Approach to Osteoporosis. And then I founded a company, Osteonaturals. And the reason why I did that was I wanted to offer 2 things to people. Number one, dealing with osteoporosis can be very complex. So I wanted there to be an easier way for them to approach it with certain supplements, but I also wanted to offer people information. So I write a blog so people can learn about current research that's out there that can help them.
And like you said, it's not just about calcium. You have a very unique approach to that's different from other practitioners. Now, obviously, it's not just about getting your milk or just about making sure that you're eating the right foods. It's about taking care of your whole body.
It is. When people are typically first diagnosed with osteoporosis, they're offered a bisphosphonate, they're offered a drug to take. And I just feel like that doesn't go far enough, that people should we should look closely at a person's biochemical individuality. And so one person may need 600 milligrams of calcium and some magnesium, X amount of vitamin D, but another person is completely different, and they might need totally different things. They might need antioxidants like alpha-lipoic acid to decrease inflammation in their body. They might need powerful herbs such as berberine or curcumin that can help a lot. So we have to look at that person as an individual. So whenever I approach people with bone loss, I do several things. I look at their signs and symptoms, I do a lot of laboratory testing, and then I determine, does this person have digestive issues? Do they have situations where they have a lot of inflammation in their body or oxidative stress within their body that needs to be reduced? Because that's actually one of the most important reasons why people have bone loss. So if a person is inflamed, their body's inflamed, then it decreases their ability of the osteoblasts, they're the cells that form bone, and it increases the osteoclastic activity. Those are the cells in the bone that destroy bone. So those aspects of bone biology have to be improved for a person's bones to get healthier. It doesn't just work to just take more calcium.
Right. And like you said, we're all unique. We all have to be treated that way. Right. How can someone tell if they have osteoporosis? What are some of the signs that they should look out for?
That's the problem with osteoporosis. There typically are no signs until a person fractures, breaks their hip, or they get a compression fracture. And that is a major problem with it. And so the best way to determine is to have a bone density examination. And typically that isn't done till a person's 50 or 55 or even 60 if they're a male. I was diagnosed with osteoporosis at age 45.
And you said severe as
severe
well.
osteoporosis. I had 12 fractures over a period of 5 years. And, you know, so to me, I think people should have bone density exams actually earlier than age 50 or 55, 60.
Well, it sounds, especially in your case, and you were talking to me earlier and said you never smoked, you never really drank, and you exercised, you ate well. Right. So even with all the things that you can control, you never know, because it's not just about drinking your milk and getting calcium, as you're saying.
I did everything right in my life,
right,
and I still had osteoporosis. So it really makes sense to find out earlier, because the earlier a person finds out if they have bone loss, the more they can do something about it.
Absolutely, absolutely. And your book, The Whole Body Approach to Osteoporosis, isn't just for osteoporosis. It can help you in your overall health.
Right, because osteoporosis is a chronic disease, the same as Alzheimer's, the same as heart disease, diabetes, and they almost all have one underlying factor amongst them, and that is chronic inflammation. So if you can decrease the inflammatory nature of your body, then you're going to improve your bone health, you're going to hopefully ward off other disease processes. And that's what my book's all about. It really explains to people how you can do this and not just gain healthier skeleton, but healthier overall health.
Wonderful. Well, I certainly learned a lot, and I'm sure everyone else did today. Thank you very much, Dr. McCormick. Great to have you here. And to learn more about Dr. Keith McCormick and to visit his blog online, you can visit osteonaturals.com.